Ruhuha sector is located in Bugesera district, Eastern Province, on 42 kilometers from Kigali, Rwandan capital city. Its elevation is 1300, latitude 2 degrees 19 minutes 39 seconds, with 54 kilometers square. Population of Ruhuha is 19,606 and household 4,279. Ruhuha sector has 5 cells and 35 villages, with 1 health center and 140 community health workers. Ruhuha sector is bordering with the Republic of Burundi. Rwanda's Malaria Strategic Plan 2013-2018 targets to achieve malaria pre-elimination levels of transmission by 2018. In collaboration with Rwanda Ministry of Health, the Netherlands Organization for Scientific Research, WOTRO, Science for Global Development provided financial support for a 4-year research program entitled Empowering the Community Towards Malaria Elimination in Ruhuha sector. How can a community contribute to the malaria control program towards its elimination?
Nitwa Furaha Anatolia, ndi umujyanama w'ubuzima, ntuye muri uyu murenge wa Ruhuha, akagari ka Gikundamvura, umudugudu wa Kiyovu. Na mbere tubashishikariza kurara mu nzitiramibu ikoranye umuti. Ikindi tubashishikariza gukuraho ibidendezi bihuru bikikije ingo, gukinga amadirishya hakiri kare, kandi tukabashishikariza no kuba uramutse agaragaje ibimenyetso bya malaria agomba guhita yihutira kujya kwa muganga kugira ngo abashe kumuvura. Imbogamizi dukunda guhura nazo yo dushishikariza abaturage kuryama mu nzitiramibu, akenshi bakunda kutugaragariza indwara y'ibiheri, ko hari udusimba twateye tw'ibiheri, bavuga ko iyo baryamye mu nzitiramibu twa dusimba tubasha kugaragaramo. Ubwo rero ku ngamba twafashe, dufite ingamba zo kugenda urugo ku rugo dukora umuganda mu mago, tubashishikariza uburyo bwo kurwanya ibyo biheri. Ubu ku kigero tugezeho tugereranije n'abaturage bacu uburyo babyitabira n'uburyo kandi natwe tudahema gukorana nabo, usanga nibura abarara mu nzitiramibu bageze kuri 98%.
Muri uyu murenge wa Ruhuha urebye malaria kwihagaze ubu ngubu ntabwo navuga ko bikanganye, ariko ugereranyije n'ingamba zafashwe n'ubuyobozi muri no minsi ishize biragaragara ko yagabanutse dushingiye kuri raporo tubona zituruka ku kigo nderabuzima.
Mobilization malaria endemic community to adopt integrated malaria interventions based on available research data toward malaria elimination. To contribute to Rwanda's strategy of achieving malaria pre-elimination by connecting social mobilization to national malaria control program and local available data.
Kandi twaba tutangaje ku mugaragaro ko iyi gahunda igiye gutangira muri uyu murenge batwereka ibyagezweho.
Nitwa Dr. Steven Gruß, nkaba ndi umuganga n'umushakashatsi muri University y'u Rwanda mu ishami ry'ubuvuzi. Tangiye nyuma y'imyaka igera kuri 5 twari tumaze dukora ubushakashatsi kuri malaria mu murenge wa Ruhuha. Hanyuma tuza kubona yuko hari malaria nyinshi iri mu baturage kandi noneho itazana ibimenyetso bya malaria bisanzwe, no kuvuga abantu bageneraga malaria ntibazaga kwivuza kuko nta bimenyetso bari bafite. Hanyuma rero tuza gutekereza ko kugira ngo turandure malaria ntibishoboka dukoresheje uburyo busanzwe bwaho tuvurira abantu baje ku bigo nderabuzima. Noneho dusanga yuko tugomba gushyiraho uburyo bwaho abaturage ari bo baba intango yo kurandura malaria. Noneho dutangira uyu mushinga kugira ngo tuganire n'abaturage, tubigishe ibitera malaria, tubigishe uburyo bwo kurandura malaria, noneho aba aribo baba nka moteri yo kurandura malaria. Hanyuma twebwe tube abo kubaha gusa nk'imfashanyigisho niba ariko navuga cyangwa kubigisha gusa ibindi akaba aribo babyikorera akaba aribo bajyana uyu mushinga bakirandurira malaria mu ngo zabo no mu miryango yabo. Niyo yari ide twari dufite kuko ibitera malaria twari tumaze kubibigisha tubona babizi, ubwo rero icyari gisigaye ko ari ukubigisha uburyo bashobora kwirandurira malaria, nibwo buryo bwonyine twabonaga bushoboka.
This project we try to achieve malaria elimination within the Ruhwa district by combining 4 different blocks of expertise and really together with the community participation approach as well. I think that combination of those 5 blocks will help the national policy in achieving malaria elimination.
PhD research projects based on
There's a component of biomedical science just addressing the issues of resistance or anemia related to malaria and other issues, or also treatment. So there is another component on behavior science addressing the issues of the behavior of the population, the community. How did they change their mind just to eliminate malaria? The third one is addressing the issues of mosquitoes, is the entomological component, and just to know the behavior of those mosquitoes and in order to achieve this goal. And the last one is addressing the issues of finance and economic, trying to combine with this in health system. So those 4, we thought that those 4 building blocks can work together and then to achieve the target that we are looking for.
And as was already earlier mentioned, there were these 4 building blocks, and there's 4 PhD students involved in this program, 4 PhDs from Rwanda. They have received some training in the Netherlands, either in medicine or in entomology or health economics. And all of us find this very important, that the local capacity is improved, and that these 4 PhDs are now using that knowledge and implementing their knowledge and expertise here in Rwanda, and thus can contribute towards our shared goal of malaria elimination.
We have also a scientific component of this, where we are going, the project will provide evidence through specific research under the different blocks of this project, so that we will provide answers to some problems that the national malaria program is facing in the strategies to halt malaria elimination.
As part of capacity building, 4 Rwandan PhD students enrolled at 4 different Dutch universities for pursuing PhD studies in the field of behavior sciences, biomedical sciences, medical entomology, and health economics. PhD students work on their projects in an integrated manner.
The key role of my component is about facilitating the entire program, looking at different group dynamics, looking at how the community can be engaged, how they can be committed towards eliminating malaria in their sector of Ruhuha. And to do so, we have had several sessions with the community. The first session with the community we had was in 2010 and 2011, where we had invited different community representatives here in Ruhuha, and we get together to discuss about how malaria can be eliminated, but first of all, if this is possible. And we have seen that it can be possible to be eliminated, and the community in the discussion also had proposed something that we can do. The first one was about how we can have the active diagnosis of malaria in the whole sector, and also to treat those who are found to be positive. And therefore we have also had the household survey, in which we have had almost all the household in Ruhuha, and we have had several questions but also we tested for malaria, and those who were found positive were treated.
This program is mainly based on eliminating malaria. So malaria is an infection, and in terms of my interest from a biomedical aspect is understanding the disease in this population, understanding who has the problem. For example, is it men, is it women, is it children, is it fishermen, is it rice-growing communities, who has the problem? Number two, it is to understand what are the risk factors that are causing this problem in this community. If we find that, for example, men are more at risk, is it the men who actually grow rice who are more at risk? Then I also want to understand this problem, where is it distributed? There are 35 villages in this community and about 5 cells. We would like to know, is the problem more common in one cell compared to another? And if so, what are the reasons, what are the environmental reasons that are associated with this problem being more common in that particular village? And lastly, I would like to find interventions that can lead to a reduction in malaria transmission in these communities. Previously, we have mainly focused on malaria cases, people who are sick at the health center, but as our goal is to eliminate malaria, the focus has to shift to people who are infected, those who may not have clinical symptoms, because we need to treat these people, or we need to reduce their infectivity, so that even if there are mosquitoes out there, when they bite them, the mosquitoes don't get infected, and therefore malaria is not transmitted. So my contribution is basically to understand disease burden, to find ways or interventions for that matter that can actually lead to a reduction in transmission, and therefore an elimination of malaria in this particular community.
And also to know how many infected mosquitoes biting a human by month or by year. And also to understand if there is any pattern of resistance of mosquitoes to insecticide we are using for vector control. And after, it's also to know where mosquitoes are breeding. Mosquitoes are breeding at peri-domestic area or are breeding in marshlands. And after, to know what is the density of mosquito larvae in marshland, or how is the density of mosquito larvae in peri-domestic areas. Those are the key parameters to understand very well the dynamic of malaria vectors and also behavior of mosquitoes. The second component was to understand the environmental parameters, such as the seasonality of transmission of malaria and also the topography. There is probably any relationship between malaria vectors with the water bodies, with the hydrology, housing, prevention measures. Those are the key questions we had to understand in order to empower community towards malaria elimination. You can't eliminate any disease without knowing the key parameters of transmission of that disease.
For the rice farming, as you may be aware, it has positive and negative impact. The positive one is the economic private benefit of rice farmers from this rice farming, and the negative one is the malaria risk, not only for them but for the entire community. And in my project, I need to think about some innovative mechanism that could be used in order to utilize benefit from those rice farmers to mitigate the risk caused by their practice.
A memorandum of understanding between Academic Medical Center, Amsterdam, the Netherlands, and the Rwanda Ministry of Health was signed in September 2012.
This project was selected from a number of projects that we received based on a quality ranking. And this project was selected because it The program committee who does the selection was very enthusiastic about the approach for real elimination of malaria, because it's a step further than a lot of malaria programs usually have, and because of the approach with involving the community and having a bottom-up approach to go to those last steps of malaria elimination.
Knowledge Translation Network is a 3-year WOTRO-funded project which is supporting the 8 coalition partners that are funded by WOTRO, and these partners are spread across sub-Saharan Africa. Right now, the Knowledge Translation Network is working with MEPR so that they can translate the research findings from the malaria elimination project into policy and practice. And what we did with this dissemination is to support them with the first dissemination of their research findings. Yeah, so that's what the Knowledge Translation Network is doing. We are here to work with them so that their research findings get out to the community, to the policymakers, as well as other relevant stakeholders. Yeah.
Establishment of Community Malaria Action Team involving a village leader.
Tugerageza kuyishishikariza abaturage tubigisha uburyo bwose bushoboka bwo kuba twayirandura dukoresheje uburyo bwose bushoboka, twakira abatera umuti mu mazu, tubigisha uburyo bashobora gukuraho ibihuru bidukikije, gusiba ibinogo birekamo amazi n'ibindi bintu byose byatuma umubu wororoka.
A community health worker and youth representative per village are being set up.
Ibyiza tubonamo muri uyu mushinga nuko rimwe na rimwe abaturage bari bagiye bafite imyumvire iri hasi badasobanukiwe malaria neza ikintu kiyizana, ariko uyu mushinga kuba wamanutse ukaza mu baturage hari imyumvire irimo igenda izamuka.
Umushinga wo kugira ngo barandure malaria twabakiriye neza, kuko rimwe na rimwe wasangaga hariho n'impfu nyine zo ku bana bato kenshi, cyangwa umuntu akanarwara malaria ariko ntanabimenye, ugasanga agiye muri za Kinyarwanda bakamuhereza imiti nyine nk'ibyo ngibyo, ugasanga ari kwivuza n'ibyo atazi. Ariko bo baje mu bushakashatsi wenda byabaho no kugira ngo tubashe no kubona n'iyo miti batera mu nzu mu buryo butworoheye, n'ayo masupaneti tukayabona, bituma igenda igabanuka.
These members will work very closely with the community at large through existing structures, will provide feedback to both communities and research team.
We started with a meaningful conversation with the community, with representatives from the community, and just asking questions on how can we do this together. And we've been doing that a couple of times, and we strongly believe that if we have meaningful conversations with people, with everybody involved on all levels in community, politics, etc., that people become, they take ownership, because their opinion matters and everybody's opinion matters, and when your opinion matters you can attach your heart to it as well, and you feel noticed in a community, and that is a very important issue in this project, that we are not people that know all the answers, and we're not coming from the Netherlands to solve the problem. We don't know how to solve the problem alone. We really need everybody to collaborate, so we are all here as human beings that want to make a better world, and in this case it's a better world without malaria in Rwanda, with the Rwanda community.
has 5 cells and 35 villages, with 1 health center and 140 community health workers. Ruhuha sector is bordering with the Republic of Burundi. Rwanda's Malaria Strategic Plan 2013-2018 targets to achieve malaria pre-elimination levels of transmission by 2018. In collaboration with Rwanda Ministry of Health, the Netherlands Organization for Scientific and Community contribute to the malaria control program towards its elimination.
Nitwa Furaha Anatolia, ndi umujyanama w'ubuzima, ntuye muri uyu murenge wa Ruhuha, akagari ka Gikundamvura, umudugudu wa Kiyovu. Na mbere tubashishikariza kurara mu nzitiramibu ikoranye umuti. Ikindi tubashishikariza gukuraho ibidendezi bihuru bikikije ingo, gukinga amadirishya hakiri kare, kandi tukabashishikariza no kuba uramutse agaragaje ibimenyetso bya malaria agomba guhita yihutira kujya.
Research, water, Science for Global Development provided financial support for a 4-year research program entitled Empowering the Community Towards Malaria Elimination in Ruhuha sector. How can
kwa muganga kugira ngo babashe kumuvura. Imbogamizi dukunda guhura nazo iyo dushishikariza abaturage kuryama mu nzitiramibu, akenshi bakunda kutugaragariza indwara y'ibiheri, ko hari udusimba twateye tw'ibiheri, bavuga ko iyo baryamye mu nzitiramibu utwo dusimba tubasha kugaragaramo. Ubwo rero ku ngamba twafashe, dufite ingamba zo kugenda urugo ku rugo, dukora umuganda mu mago, tubashishikariza uburyo bwo
Ruhuha sector is located in Bugesera district, Eastern Province, on 42 kilometers from Kigali, Rwandan capital city. Its elevation is 1300, latitude 2 degrees 19 minutes 39 seconds, with 54 kilometers square. Population of Ruhuha is 19,606 and household 4,279. Ruhuha sector